Okay, welcome to the shoulder scan along video. We're going to start with your patient just sitting upright, and we're going to take their hand. We're going to first start with the anterior structures, namely the biceps tendon, and we're going to make sure their shoulder is in a neutral rotation, so that way the long head of the biceps is kind of right in front. If they are in a rotated position, it's going to tuck in anteriorly, and it's going to be hard to visualize. And so we usually just say, take your hand, palm up, and just place it kind of right on your thigh. And then that gets them in the good starting position. We're going to take our probe, and we're generally always going to start with their indicator when we look at short axis towards their right shoulder. Now when we do that on the screen, just keep in mind, I'm going to change my depth a little bit here. To the left of the screen is lateral, and to the right of the screen is medial. So whenever you start and put your probe down, always just make sure you know where your indicator is, so you know what's on the left side and what's on the right side. So once we know this is lateral, we know that's the greater tuberosity. We're looking for bony acoustic landmarks. So we want to find the greater tuberosity and the lesser tuberosity here. And between those is the bicipital groove. So this is what we call, like in the shoulder region, I like to call it home base. So find the first thing you're going to look at. You're going to put the shoulder right in this position, put your probe right down on the front of the shoulder, and look for these bony acoustic landmarks. Once you do, you find the greater tuberosity and the lesser tuberosity, we can start to identify a lot of different structures. Namely, on the top, you're going to see the deltoid is going to be very large muscle, kind of all throughout the shoulder region. This is going to kind of almost get in our way. So someone with very large shoulders, it might make the rotator cuff a little more difficult to visualize. But then when we come deep, we're going to look for these bony acoustic landmarks as our backdrop, and we're going to start identifying structures. The first one we're looking for is the biceps tendon, which is going to be in this groove. And the easiest way to identify it is to take your probe and kind of toggle up and down like this. And what should happen is you kind of make it smaller motions. You should see that a hyperechoic structure appear and then become hypoechoic. And you want to make sure you kind of do that throughout. And we're looking for any kind of fluid around this tendon, but it should kind of stick out between that and the other connective tissue that's around it. Once we've identified it, we want to slide the probe both cephalad and caudal. And if we start going caudal, we're going to change our depth a little bit. What should happen is further you come down, you'll start to see a tendinous structure going from medial to lateral, and that's going to be your pec tendon. And so it's going to come right here, kind of right over top. And so there's part of the pec tendon right underneath the bicep. But you could continue to visualize the bicep, but usually I like to go down at least far enough to visualize this pec tendon. So if you're looking for any pec tears, you can do that there. Then we're going to move our probe back up and make sure you kind of can continue to find the long head of the biceps and short axis. And we're going to be right back in this groove. You can keep coming up out of the groove to visualize the long head of the biceps as far up as you can go. You can even move their shoulder into a little bit of extension. You can see I got to move my probe. And as you do that, it's going to kind of move on you. It's right here. And this is around the rotator cuff interval. And you can keep moving your probe. And we're going to probably lose it a little bit as we keep coming up. But you can try to visualize it as far up as you can go. But you're probably going to lose it the further up you go. It's going to kind of dive underneath the acromion here. And so right here's the acromion. But it's going to dive under some of these osseous structures. All right. We're going to come back down kind of that home base between those two bony structures, and you want to take your biceps tendon here again, kind of toggle and make sure it appears and disappears. And when it disappears and comes You would say maybe anechoic, that's anisotropy, that's just an artifact, which we talked about before. But once you've find this tendon, we want to look at it in long axis, and we're going to take our probe after we position it kind of right underneath this indicator, and we're going to turn the probe 90 degrees. And if it's right underneath this little indicator in the middle of the screen, you should be able to just kind of keep it, if you can do this just one hand or two, but as you turn it, you should be able to keep it kind of right on the screen. And so right here is the long head of the biceps here, and we're looking for this very bright fibrillar pattern kind of going left to right. And we're looking for any fluid or any kind of pathology along there. Now, if you have a hard time finding it, you can just slide your probe medial and lateral. And so if you come medial, it should run into the lesser tuberosity. If you come lateral, it should run into the greater tuberosity. So it kind of goes bone, tendon, bone. So once you know you're kind of here, you can start to identify it. And so we can look at it kind of all the way up and down along that structure if you like, and you can come all the way as far as you want as well superiorly, but it's going to become difficult to visualize as you move further up the shoulder. Okay, so after we've looked at it in long and short, we're going to turn our probe back into short axis. And now what we want to do is dynamically look at it and make sure it remains in the bicipital groove. And so all we're going to take with our patient, we're going to take their arm and just externally rotate it. I'm going to do it kind of down here. As they rotate it, you see it'll move out of screen, and so you kind of have to move your probe with them to make sure it just stays in that groove. And that's all we're looking for. Just make sure it does not sublux out. From right here, once we're in, this bicipital groove, your bony acoustic landmarks are right there. We're back at home base. We're going to look at the subscapularis, which is going to be coming off the lesser tuberosity. It attaches there, and so that's this structure right here. If we keep moving medially and come up a little bit, you can find the coracoid here, and it slides underneath that bony structure. Right here is the coracoid. You can even start to see some of the coracohumeral ligament here on top as you move, if you move more cephalad. But we're looking more for this tendinous structure right here. And so if you're having a difficult time visualizing it, because here it's a lot of anisotropy because our probe, we're going to have to position the probe all the way around, move more medially to try to get it, the structure, the fibers perpendicular to the sound head. But you can also just move their shoulder in a little bit of internal or external rotation. And I like to make sure I kind of slide as I do this, the probe superior and inferiorly, to make sure I look at the entire subscapularis. After you looked at it here in long axis, you're going to want to turn your probe again 90 degrees so we can look at it in short axis. And from here, this rotator cuff muscle or tendon actually has a kind of an interesting appearance, where it actually has different, because the different muscle fibers have like bundles, and it looks like bundles of tendons. So don't mistake that for maybe intrasubstance tears or anything. That's just kind of the normal appearance of the subscapularis in short axis. And so you can visualize this kind of moving in and out underneath their probe. You can even just have them rotate underneath you. And it kind of has this tire on a wheel look. So here's the tire and the wheel is the humerus. And we're just looking to make sure we identify that tendon, and we're looking for any kind of abnormalities there, whether a tear, you'll see a portion of it like anechoic. You can also, once you're looking at it with any of the tendons, you can also just put them under load. And so as they're positioned there, you can have them hold, and don't let them move your arm here. And so you can push it under a little bit of stress and look for any kind of retraction or if it just makes sure they're together, all the fibers are together. After we've looked at the subscap, we're going to look at the supraspinatus. Now, the supraspinatus is we're going to take a little more time to look at the supraspinatus, just because it's where the majority of rotator cuff tears occur, and pathology occur. So we're going to take the patient's shoulder and put them into extension, and we want them. You don't want them in too much internal rotation, but if they can't tolerate it, that's okay. But we're going to try to get this elbow back as far as we can. And the reason we're doing that is because we want the supraspinatus to kind of come out underneath the acromion and kind of position nice so we can get a good visualization of it. And we call this the modified Cras position. So from here, once they're in that position, we're going to take our probe, and I like to point it, the indicator, up towards their ear. And so if you can think of like the orientation of the probe, and when we do that, we're looking at the supraspinatus in long axis. I think that's kind of difficult for people to kind of realize, but it's usually here. By position and extension and rotation, we're kind of moving it like this, and so the tendon's should be coming down like this, and so we're looking at it towards their ear. From here, we're looking for what we call the S-shaped curve of the greater tuberosity. Now, this is kind of the start of the S-shaped curve, and we're looking for, but when you start to identify it, we're trying to find fibers coming in and coming down and attaching to the bone here. You can kind of see parts of the tendon come here. If you look a little further up the shoulder, we're going to see this is all articular cartilage underneath. And we want to find this S-shaped curve here. Now, if you're having a hard time finding it, slide the probe all the way until you run into the biceps tendon here. And so once you run into the biceps tendon, then you're going to kind of move just a little bit lateral until you're right at the edge of the greater tuberosity. And the reason why we want to do that is because the majority of supraspinatus tears actually occur at the most anterior portion of the supraspinatus. So here we're looking for kind of this S-shaped curve, and we're looking for these fibers coming in and attaching down to the bone here. And this is where we really want to take our time, look at it here, and then we want to slide from anterior to posterior. And as we move posterior, you might need to move your probe just a little bit. It should flatten out a little bit. And as it flattens out, you might see some orientation of fibers coming in different directions here as we move more posteriorly. And that's just because you're going to start running into the infraspinatus. So again, we want to move anteriorly all the way to the biceps tendon. Find this S-shaped curve here. Identify some of these fibular fibers coming down, attaching. And then we want to slide our probe all the way posterior where it starts to flatten out. Okay. After we've done that in long axis, we're going to take our probe and look at it in short axis. And here I like to think the probe is pointed towards kind of their sternum. And so now it's kind of targeted this way, because again, we're looking at it in short axis. So the tendon's going here, and we're putting our probe right on top of that. And so here's where we find this tire on the wheel. Again, here's the tire is the supraspinatus, and the wheel, here's the humerus. That's our bone acoustics. This is our articular cartilage. So we're not at the distal of the attachment site yet. We want to move our probe anteriorly all the way until we can find the biceps tendon. And while you're here, you might be able to identify some of the structures around the biceps tendon, like the coracohumeral ligament should be kind of right above it, and this structure right underneath is the superior glenohumeral ligament. And so we should be able to identify a little bit of those, but right now we're not too concerned with that, with these scans. And so once we're here, we find that biceps tendon, we want to locate the tire on the wheel, and then we want to slide kind of all the way till you run out of the attachment, and then you want to come back up and we're looking for any kind of tears in that footprint, and we can find them all the way. Here's this tire on the wheel of the supraspinatus. We want to look at it from anterior here to posterior. If you keep moving up, you might run into some muscle blending in with some of these. Like it looks here, this more hypoechoic region. That's muscle of the rotator cuff. But yeah, so that's the supraspinatus. We can take the shoulder and move them out of that position. From here, we can also look at it dynamically move. And so this is the reason why we position them like that, is because you can't really see the entire supraspinatus. So if you just take the probe, put it right over the lateral portion of the acromion, here we can find the deltoid. This is the supraspinatus. This little sliver, kind of hypoechoic, is the subacromial bursa or subdeltoid bursa, and we're looking for any kind of fluid in that structure. We can also kind of move them into abduction. And I would tell you, what I do is make sure you move them. Don't let them move themselves to your most of your extent, so you can kind of control that movement. And we're just looking for any kind of fluid bunching up or accumulated there. And so that's just kind of a dynamic shoulder abduction motion. Right, after we've looked at the supraspinatus, we're going to look at the infraspinatus. And we're just going to take our probe, and I'm going to have them kind of sit this way so we can see the back of the shoulder. And you're just basically going to take the probe. You want to start, if you can find the scapular spine, you can palpate that with your fingers here. And you can just put the probe right underneath that structure, and then come lateral, and you should be able to see this very bright aponeurosis of the infraspinatus right over top of the humerus, and that's this structure right here. This right here and this right here are muscles, muscle fibers of the infraspinatus coming and attaching it into the aponeurosis to become the tendon here. And then we want to find this tendon and observe it attach all the way to the bone. From here, we can also just take that shoulder and move them into internal and external rotation to kind of look at the infraspinatus tendon attached to the humerus. You can also here do the same thing where you have them hold there, don't let them move you, and do a little bit of a stress in long axis. So you can do a couple different movements here, and you want to slide the probe up and down, or cephalad and caudal, on that tendon to visualize the entire footprint of the infraspinatus. We also want to look at it if you're having a hard time finding this aponeurosis here or finding where the infraspinatus is. You might be, oftentimes what I find is people are a little too caudal and they're trying to scan down here and they need to move higher up. But an easy way to find it is to take your probe and position it. We'll look at it in short axis. You can do this first. And here's where the scapular spine is. And so if you can identify that bony acoustic landmark, then underneath that we know this is infraspinatus, and this is this aponeurosis. It's a very bright hyperechoic collection of connective tissue. And we can just take that and we can follow it all the way in short axis. And we can even take them and rotate them underneath in different directions so we can kind of observe the infraspinatus in short axis here. And we can look at it all the way to its distal attachment there. If you want to, you can look for the teres minor, which is this structure right here. It's a little harder to visualize here. It's a much smaller tendon. But if you want to identify it, we can do the same trick we did for the infraspinatus, where we found this kind of bundle of connective tissue here for the infraspinatus, and we came down below, change my gain a little bit. This is the connective tissue for the teres minor, and we can follow that where it becomes a tendon as well. Kind of right below, this is infraspinatus, this is teres minor, right there. So you can do that if you'd like to. I don't really find a lot of pathology in the teres minor, so don't spend a lot of time visualizing it. While we're here in the posterior shoulder, we want to look at the posterior glenohumeral joint. So we're going to turn our probe again, almost like we're looking at the infraspinatus and long axis. We're probably going to change our depth to see deeper, so we can see the humerus here, glenoid. Here's so you almost can see the suprascapular notch and nerve. But here is where we want to see the glenoid. Here's the labrum. This is the humerus. If you're having a hard time, again, you can just rotate humerus around and kind of look at that joint move. And we want to scan superiorly. This is the humerus, glenoid, labrum. And we want to scan distal until we run out the distal portion so we can see we're almost coming down close to the quadrangular space there. But here we're looking for any kind of fluid accumulating here, any perilabral cyst that might compress the suprascapular nerve. And then another way you can visualize this even a little easier if you'd like, you can take the shoulder and have them put it on their other shoulder, or take their hand and put it on their opposite shoulder. And what this does, it kind of gives you a little bit of a better view of the humerus and glenoid here. You can kind of get a little slightly better view with them in that position. So you can do this as well. All right. The last thing we're going to take a look at in the shoulder is the AC joint. Now this is a much more superficial structure, so we're going to change our depth. And we're going to take our probe. You can just palpate the AC joint if you'd like and put the probe right on top. I do find this can be a difficult joint to identify, so easy way to find it is to locate one of these two bones. And so this is to the left. I'm kind of backwards the way I started. I'm sorry. Oh, we'll do it. Let's keep it this way. So to the left here is the clavicle. I've kind of moved my probe backwards from where I started. I'm going to move it back so the indicator's towards the right shoulder. And so now to the right here is the acromion, and to the left here is the clavicle. Not to add confusion here. But identify one of those two bones so you can identify the joint. And we're looking for any kind of fluid. We want to see kind of smooth margins on these bones. You can look for any kind of pathology, abnormality. You can stress this joint as well and look at it under ultrasound. All right, and so that concludes the scanning in the shoulder region. Thank you.